I'm now going to talk about the sartorius muscle, which you can find here. The name comes from the Latin sartor, meaning tailor. The sartorial muscle is the most superficial muscle of the anterior thigh and also the longest strap muscle in the body. The medial border of the upper third of this muscle forms the lateral boundary of the femoral triangle. The adductor longus forms the medial boundary and the inguinal ligament forms the superior boundary. The sartorius muscle is so long that it crosses and acts upon both the hip and knee joints. Acting on the hip joint, the sartorius works as a flexor, abductor, and lateral rotator of the thigh, with the assistance of the other major muscles of the hip. At the knee joint, the sartorius helps to flex the leg. Combining all of these functions into one movement, the sartorius pulls the foot and ankle towards the knee of the opposite leg. The action of the sartorius is used in many situations, such as crossing the leg so that the ankle rests on the knee of the opposite leg, sitting cross-legged, or looking at the sole of one's foot. In fact, the name sartorius and its nickname, the tailor's muscle, are derived from the common motion of tailors crossing their legs to sit while working. Trigger points in the sartorius can cause pain at many points in the muscle. Keep in mind that trigger points in this muscle do not radiate pain far from the trigger point. If you are experiencing pain near the hip, the trigger point will be in the upper portion of the muscle. If the pain is near the knee, the trigger point will be in the lower leg near the knee. Signs and symptoms may include burning and/or tingling along the muscle or segments of the muscle, sharp stabbing pain that is felt just under the skin along the length of the muscle, sharp pain when you step back too far, sharp pain when you lift the leg behind the body, stabbing pain when you twist the knee. The inside of the knee may become hypersensitive. Sitting relieves pain, and sleeping with a pillow between the knees relieves pain. So what causes trigger points to develop in the sartorius? Sitting cross-legged and in the lotus pose puts enormous strain on the sartorius. Sitting with your legs up and crossed in a recliner or resting on an ottoman. Sleeping on your back or stomach with your legs crossed. Slipping or taking a misstep. Planting your foot and pivoting, making a sharp turn. Pushing off your foot hard to accelerate quickly. And sports and activities that require fast turns, pivots, quick acceleration, and extended strides. So how can you avoid development of trigger points in the sartorius? If you habitually sit with your legs up, occasionally drop them down and rest your feet on the floor. Even better, get up and walk around. Before walking, jogging, running, exercise, or participating in sports, take time to warm up and do some light stretches. Take time to stretch out upper and lower leg muscles after running and exercise. When walking on slick surfaces, pay attention to your steps. Don't slip and try not to fall. If practicing yoga, be aware that the tree pose, lotus pose, butterfly pose, and fire log pose are stressful for the sartorius muscle. Don't try to push beyond what your muscles are capable of doing. Inhibition compression technique can be used by an experienced trigger point therapist to relieve the pain from the trigger points. In addition, self-massage may help as it can be a painful and delicate area, as well as stretching exercises and sleeping with a pillow below your knees.